Hi everyone, a podcast centered on health and wellness. In conjunction with Colorectal Cancer Awareness Month, we are going to talk about the modern advances for colon cancer treatment. So today's episode is focused on colorectal cancer patients who are currently undergoing treatment, and of course, for those of you who were recently diagnosed. We hope that we can provide a lot of information to you through today's episode. And as you all may know, if you follow me, I'm a colorectal cancer survivor. So this topic is always close to my heart, and I always believe in advocacy. Why? Because let me share with you a little bit more about the statistics. But before that, I would like to ask you to share this with your friends, with your family, get them to tune in to find out more about colorectal cancer. And also, if you have any questions, for those of you who have never been on the show, you can put them in now because we'll try to answer as many questions as possible towards the end of the show. Now, where does the colorectal tract encompass? It basically encompasses the colon and the rectum, which means you can get cancer in your colon or in your rectum. For example, I'm a rectal cancer survivor. So the cancer happened in the rectal area. And for colorectal cancer, it is globally the third most common cancer and the second leading cause of cancer deaths at 10%. 1 in 23 men have a lifetime risk of colorectal cancer and 1 in 25 women. The statistics sounds bleak, but don't worry because we've also found out that the 5-year survival rate, if your colorectal cancer is detected early, is 90%. That's huge. Versus if you detected it late, it drops to 15% or so. So the difference is stark when you talk about the numbers. So the most important part is to go for screening. And if you have genetic history, you need to go for screening and find out how to. I think this month, there's a lot of information on how to screen. That's why we want to focus on all the modern advances that is available for colorectal cancer and the hope and healing out there. We want to give you hope. And during this time, please share this live with your friends and family on YouTube or Facebook. Get them to tune in. And more importantly, if you have questions, you can put them in now. I would also like to introduce our two esteemed doctors who have years of experience. We have Dr Aktbar, who is a colorectal surgeon with Sanjal Medical. Hi, doctor. Thanks for coming on the show. And we have no stranger to talking live with Mei Sze, Dr Jenson, who is a clinical oncologist at Curie Oncology. So you've met him before. Thank you for coming back on the show. So like I said, we're going to dive into colorectal cancer right away. So I'm going to start with the questions. If you have questions, you can put them in now. So Dr. Qureshi, my first question for you is, for someone who have been diagnosed with colon cancer through a colonoscopy, the dreaded colonoscopy, what is the next step or approach from a colorectal surgeon?
Okay. Once you've been diagnosed with colorectal cancer, then what will happen is that you will have blood tests done, okay, and you will have what we call imaging done. So the blood test is primarily to ascertain the level of hemoglobin. That means make sure that you haven't lost too much blood from your cancer, making sure that you don't have any other issues such as kidney issues or liver issues. And then of course the imaging. Imaging in terms of colorectal cancer is primarily either a CT scan or an MRI. Now, the idea of this imaging is to look at the cancer that was found at colonoscopy. Now, what the colonoscopy does is that it looks at the cancer from within. So if you imagine you're in a tube, you're only looking on the inside. You don't know what's happening on the outside. And that's where the imaging comes in. And the imaging then tells us whether this tumor is limited to the bowel wall, or has it breached the bowel wall? Has it involved the lymph nodes? Does it affect the liver or the lungs? And so when I get a patient like this, so we get the imaging done, and when with that imaging, I will then have a discussion with my good friend here, Jenson, together with the radiologist, and each and every patient is discussed in depth in relation to the findings, and then we set out a plan for the patient. So, for example, for patients with a rectal cancer, some of these patients would require radiotherapy before surgery, and again, that is a discussion. It's not just a one-person decision. It's actually a team, what we call a multidisciplinary effort. Okay,
Yeah.
so then if the patient requires radiotherapy before surgery, then we would discuss the pros and cons of either a short course or the long course. And again, it's an in-depth discussion before we proceed to surgery. Now, so generally speaking, nearly all patients with colorectal cancer will have some form of surgery. And the surgery entails removing not just the cancer, but a good margin on either side, okay? So above, below, and surrounding. So, and to make sure that you've got the tumor with clean margins, as well as the lymph nodes that are associated with that tumor. And then once that has been sorted, with the report, then again, the oncologist comes in, and then we make a decision as to whether additional treatment may be required. So where if the treatment is given beforehand, we would call it neoadjuvant treatment. But if it's done afterwards, we call it adjuvant treatment. And then, of course, Dr. Jenson, okay, will then have in-depth discussion with the patient based on that report as to whether or not adjuvant treatment is required, because that report will tell us about the staging of the tumor. One additional imaging that is done for a number of patients, and usually the oncologists will ask for this. It can be done before or after surgery, is the PET scan, okay? And a PET scan essentially scans the entire body, okay, to look for potential sites of spread of this tumor. So, for example, lungs, liver, bone, and anywhere else. Okay, and it's a fairly good assessment for spread.
Thanks for the detailed information. So if you were diagnosed through a colonoscopy, you can go for you go for imaging and blood tests after.
Yes.
So that is the next step for
Precisely, yeah.
colorectal cancer patients who were recently diagnosed. Now, Dr. Jenson, we were talking about the stages Dr. Qureshi mentioned. So if someone has already been diagnosed with early stage colon cancer, how would you then approach them in terms of further therapy? Because I think Dr. Qureshi mentioned that it's either adjuvant or neoadjuvant, or sometimes is surgery just enough?
Yeah, so thanks, Mei Sze. So as an oncologist, the stagings of the cancers is very important, because that is sort of gives the oncologist the idea at what stage, what sort of treatments that needs to be given to the patients. So the staging here starts all the way from the initial assessments of the patients. So by doing so, with the imagings, by the clinical assessments, the surgeries, the outcome of surgeries, the reports, as an oncologist will go through all these details, and finally comes down to the final staging of the tumor. So for someone that is talking about early stages, so stage 1. So stage 1, basically surgery is the main modality of treatment. And stage 1 patients doesn't require, with a good surgery, the patients do not need or require an so-called adjuvant chemotherapy. Now, as the stage goes up, stage 2 and stage 3, this is where things will get a little bit more complicated, because we know that, based on the evidence that we have learned, that in stage 2, by just doing a surgery alone, the chance of the cancer relapse is actually now has gone a little higher compared to stage 1. And Of course, in stage 3, this risk of recurrence in 5 years after surgery alone can reach up to as much as 50 to 60%. So in these circumstances, the oncologist will sit down to the patient and explain about the final reports from the surgery that's been done, and will discuss with the patients about the role of chemotherapy. So at this point of time, I think in the early stages, chemotherapy still plays an important role in terms of treatment. So for someone that is diagnosed with stage 2 and 3, the oncologist will discuss with the patients on the reasons of doing such treatments. Basically, you wanted to achieve a potential cure here. You want to kill any microscopic potential cancer cells that still remains behind, and you want to increase the chance of, from avoiding these cancers from relapsing. Yeah. So that is the, the part about early stages. Then of course, when we talk about the more advanced disease, that is the part whereby things will get even more complicated because of the systemic therapies, which will become the main treatment modalities. Yeah.
Okay, so we'll talk more about that in a bit. So back to you, Dr. Qureshi. I think removing parts of the colon, like you mentioned, surgery is a part of the treatment.
Yes.
So it's a big surgery. I mean, I know I've been through colon resection. So what are the types of surgical approaches and perhaps minimal surgery for people who want to recover faster?
Sure. Okay, so as far as surgery is concerned, now there are basically we can divide this into open surgery.
Yeah.
Okay, and then we can divide it into keyhole surgery.
Laparoscopy.
Now, so keyhole surgery is then subdivided into laparoscopic surgery and also robotic surgery.
Yeah.
And there is an additional approach which we also do employ, and that is transanal excision of tumors. Okay, so just to get the transanal out of the way, transanal is where some patients, okay, they may say after a course of chemoradiotherapy, the tumor shrinks to quite a significant amount. It's very close to the sphincters, and we do a transanal, which means without going through the abdomen,